Hi, welcome to Health Talk with Dr. Akram. Today in our special YouTube edition, we'll be talking about breast self-exam. How should I check my breasts? There's no right or wrong way to check your breasts, but it is important to know how your breasts usually look and feel. That way you can spot any changes quickly and report them to your GP. Always see your GP if you are concerned. For example, breast changes can happen for many reasons and most of them aren't serious. Lots of women have breast lumps and 9 out of 10 are not cancerous. However, if you find changes in your breast that aren't normal for you, it's best to see your GP as soon as possible. This is because it's important to rule out breast cancer. If cancer is detected, then appropriate treatment should be planned as quickly as possible. When to do breast examination. If you menstruate, choose a time in your cycle when your breasts are least tender. Your hormone levels fluctuate each month during a menstrual cycle, which causes changes in breast tissue. Swelling begins to decrease when your period starts. The best time to perform a self-exam for breast awareness is usually the week after your period ends. What you can expect. Every woman's breasts are different in terms of size, shape, consistency. It's also possible for one breast to be larger than the other one. Get used to how your breasts feel at different times of the month. This can change during a menstrual cycle. For example, some women have tender and lumpy breasts, especially near the armpit, around the time of their period. First, begin with a visual examination of your breasts. Sit or stand shirtless and braless in front of a mirror with your arms at your side. To inspect your breasts visually, do the following. Face forward. Look for puckering, dimpling, or changes in size, shape, or symmetry. Check to see if your nipples are inverted or turned in. Inspect your breasts with your hands pressed down on your hips. Inspect your breasts with your arms raised overhead and palms of your hands pressed together like this. Lift your breasts up to see if ridges along the bottom are symmetrical. Next, use your hands to examine your breasts. Lying down, choose a bed or other flat surface to lie down on your back. When lying down, breast tissue spread out, making it thinner and easier to feel. Or in the shower, lather your hand and fingers and the breast with soap to help fingers glide more smoothly over your skin. Use the pad of your 3 fingers, the middle 3 fingers, not the tip, but this part of it, so you can feel it better. But in case if you have difficulty feeling with your finger pads, use another part of your hand that is more sensitive, such as palm or back of your fingers. Use different pressure levels. Your goal is to feel different depths of the breast by using different level of pressure to feel all the breast tissues. Use light pressure to feel the tissue close to the skin, medium pressure to feel a little deeper, and firm pressure to feel close to the chest and ribs. Be sure to use each pressure levels before moving on to the next spot. Take your time, don't rush. It may take several minutes to carefully examine your breast. Follow a pattern. Use a method or technique to ensure you examine your entire breast. For instance, imagine the face of a clock over your breast. Begin near collarbone and examine that section, moving your fingers towards your nipple. Then move your fingers to the next section. What's normal? Many women find lumps or changes in their breasts. Since some of these are normal changes that occur at various points in the menstrual cycle. Finding a change or lump in your breast is not a reason to panic. Breasts often feel different places. A firm ridge along the bottom of each breast is normal, for instance, and also the look and feel of your breast will change as you age. When to contact your doctor? If you find a hard lump or knot near your underarm, changes in the way your breasts look, feel, including thickening or prominent fullness that is different from the surrounding tissue, dimples, puckering, bulges, ridges on the skin of your breast, a recent change in a nipple to become pushed in inverted instead of sticking out, redness, warmth, swelling or pain, itching, scales, sores or rashes, bloody nipple discharge, etc. Your doctor may recommend additional tests and procedures to investigate breast changes, including a clinical breast exam, a mammogram, and an ultrasound. So for the time being, be breast aware, be safe. We will talk about mammogram and breast screening in our next YouTube episode. So until then, see you there and look after yourself.
Did you ever wanted to study abroad but don't know where to start? Then look no further, because IES got you covered. With dozens of universities and courses ready for your choosing, you too can earn a world-class degree for an affordable price. In your time, indulge yourself in the rich and magnificent cultures of Bulgaria and Romania without any worries, because IES will help you every step of the way, from visa application to legalization of documents and more. For further information and inquiries, contact us now. International Admission Services, making dreams come true since 2012.